All right, let's go ahead and get started. If anybody can't hear me, just go ahead and type in the chat box. Otherwise, I'll assume that you can. And I just wanted to say welcome and thank you for coming to our webinar today. And we're going to be focusing on collagen stimulation for the modern woman. And I know this is kind of a hot topic right now. Everybody's interested in ways to stimulate collagen naturally or with other types of products. But, that's the best way that we can really prevent aging and, reverse the signs of aging is to work on our own natural collagen production in different ways. So we're going to be chatting about that today. I did want to do a plug for an event we have coming up next week. We're calling it Collagen, Cupcakes, and Champagne, and it is an in-person event, and it's going to be Tuesday, February 23rd from 4:30 to 6:30. It'll be at our office, and we're going to be talking about Sculptra, which is one of the topics for today. And then also we'll have a giveaway. You can meet the rep from Galderma, Kaylee. She's a great rep, full of all kinds of knowledge. And spent a little bit of time with our staff. So if you're interested in coming to that, just give the office a call at 928-277-7414. It is limited. We have a limited amount of space, and we'll be wearing masks and doing temperature checks, of course. But I think it'll be a really fun event. So if you're interested, just let us know. All right, let's go ahead and get started. Collagen stimulation for the modern woman. So I just wanted to introduce myself to those of you that I haven't met. I'm Dr. Kim Harris. I'm a native of Prescott, and I own Prescott Medical Aesthetics, where we focus on all different kinds of aesthetic procedures, IV therapy, and wellness as well. We have another naturopathic doctor that just joined us on staff, and so she's doing primary care visits. She focuses on hormones and autoimmunity, and a list of other things. So if you're interested in having a consult with her, she does offer free 15-minute consultations. But I'll be doing the presenting today. So let's just talk a little bit about what causes aging, especially facial aging. So the six most common things in our life that can cause aging: smoking, obviously, number one. Not only does it cause damage to our skin, but also, to other areas of the body. So that's definitely something that you want to consider quitting if you are a smoker. I'd say number two is probably just sun exposure and UV rays. So we talked a lot to our patients about using good, clean sunscreen. There's a couple of products that we use in the office. One is a tinted sunscreen, but 50 SPF is going to protect you the most. So, just making sure that if you're outside, you're reapplying sunscreen every 2 hours, and that we recommend wearing sunscreen every day, no matter what. Genetics definitely play a part in the aging process. If we do mother-daughter studies, or we look at mother-daughter studies, you can definitely see the same types of progression in facial aging. As far as collagen loss, bone remodeling. So, there's not a whole lot we can do about genetics and aging, but we do have control over other areas where we can prevent and reverse the signs of aging. Sleep habits. So that's twofold. One, making sure that you get plenty of restorative sleep, 6 to 8 hours a night, but also the way that we sleep makes a difference in the aging in the face. So, making sure that we're getting plenty of sleep, but also sleeping on your back is really best. When we sleep on one side or the other, we do see more collagen loss, more loss of the fat pads. And so you can tell usually which side patients are sleeping on. So, getting a silk pillowcase, but also sleeping on your back as much as possible. Diet has a huge impact on the way that we look. So making sure that you are eating a lot of antioxidant-rich foods, green leafy vegetables, dark skin berries, lots of fruits, drinking plenty of water. And, that's something that we work on a lot here with patients, is just making sure that your diet is clean and supports the kind of lifestyle that you want. Then the other thing that can lead to aging is, just increased alcohol and caffeine intake. So reducing that or moderating those really can help. All right, so, now that we've looked at some of the causes of aging, what can we do about it? And that's really what we focus on here at Prescott Medical Aesthetics, is reversing and preventing the signs of aging. So we talked about these a lot, making sure you're drinking plenty of water. Typically, that's about half your body weight in ounces per day, depending on your activity and your health status. Eating an anti-inflammatory diet, focusing really a lot on those, non-processed foods, especially, fruits and vegetables, clean meats, and reducing sugar, alcohol, caffeine intake. Making sure you're getting 7 to 8 hours of sleep per night, or 6 to 8 hours, depending. Getting plenty of exercise, 30 minutes a day, kind of minimum. And then wearing your UV protection every day. And a lot of patients are like, well, I never go outside. Well, that's not true for most patients. They do. If you walk to your car, you should be applying SPF 50. If you're driving, we do get some sun exposure even through windows. So, make sure that you're protecting your investment, and that helps prevent future damage too. And then the other thing that we recommend is, taking good quality supplements like collagen and antioxidants. So, our food source obviously is a good place to get antioxidants, but a lot of times they're not good quality just because of our food chain. And so sometimes just taking an extra antioxidant can help a lot with prevention. All right. Everybody's heard of Botox and fillers, and that's not what we're going to be talking about today, but that's kind of what gets people in the door. They've heard of those products before, and they definitely can help. But really, when we're talking about collagen stimulation and collagen building, we need to go a little bit further into our toolbox. We do get a little bit of collagen stimulation with fillers. Anything you put under the skin causes a little bit of damage, and we do get some collagen remodeling around that, but that's not going to be our most effective tool in the toolbox to stimulate collagen. So let's talk about what we can do. Collagen, the benefit to doing that over other treatments would be we get longer lasting results with it. So first, I just wanted to talk about microneedling. We use the skin pen, and this is one of the best things that you can do to prevent signs of aging, and then also to help with some resurfacing if you already have, lines that are etched in the skin. It works really well for scarring, works great for, those fine lines and wrinkles that are around the eyes, around the mouth. If you have any lip lines, we really need to be working on some kind of resurfacing. So we use Skin Pen, which is just a specific brand of microneedling pen. There are a lot of different brands out there, but we really like the Skin Pen. We get great results with it. It is a very safe microneedling pen because sometimes you can get some cross-contamination with microneedling pens, from patient to patient, because there is some body fluids involved. So you want to make sure that your practitioner uses the correct type of pen. It is minimally invasive. It takes about an hour to do. And basically what microneedling does is it creates a little bit of controlled damage to the surface of the skin, which patients might be confused, like, why would we want to create damage to an area? But really what it does is it signals your body to come back in and remodel that area. It's kind of like, a sign, come back to this area and work on it some more. And that's how we get that collagen remodeling. It is safe for all skin types, safe for almost all patients, and you can use it anywhere on the body. So you can actually, a lot of people have wrinkling on their décolleté. You can have a little bit of collagen loss and sagging, like on the arms after weight loss. So it is a safe and effective treatment for all of those areas. How does it work? So, what we do is we run this and that has quite a few needles in it across the surface of the skin. And you can have a little bit of bleeding, but it doesn't go very deep. We're looking at about 1/2 to 2 millimeters, kind of depending on the area of the face, and it can go deeper on the body. But what we're trying to do is create a little bit of inflammation with a lot of different pinpricks, and they're very microscopic, so you really typically don't see the holes. But that also allows us to infuse different types of serums into the skin by opening up those little holes. So once that wound or that inflammation is created, then your body sends signals out, just like with any wound healing, you're going to get signaling out to come back and heal that area. So that's what we're asking your body to do, is come back. We get new networks of blood vessels. So we're bringing in extra blood to the area to repair it. And then as the wound is healing, you get this nice collagen remodeling over the top of it. Just a little bit more information about Skin Pen. Like I said, it's safe for all skin types. The procedure takes about an hour total. We numb you up, so it's very comfortable. And then as far as downtime, we're looking at about maybe 24 to 48 hours of looking like you've got a mild sunburn. So patients are very satisfied, not only with their results on this one, but also, with the lack of downtime, you can put a little bit of our tinted sunscreen over it and nobody will even know that you've had anything done. We do recommend 4 to 6 treatments, and really this is as natural as it gets. We're not injecting anything into the skin. Depending on the serum that you choose, it really varies the treatment. But we can just do a hyaluronic acid, which helps hydrate and smooth the skin. We can do PRP, which is from your own blood. We actually do a blood draw and use your own platelets to microneedle back in. Or my favorite is the stem cell microneedling. We see the best results with that one. So, it's natural. Patients don't react to it. Very safe. So we love the Skin Pen microneedling here. Here's just a couple of before and afters, so you can see, just like how natural that woman on the left, how great her results are. She's had 2 procedures, which is not that many. We're looking at about 2 months to get those kinds of results. And then on the right, I did talk about some acne scarring, and it does help with active acne as well. So we work a lot with our younger patients on repairing some of those deeper acne scars that they have. The next procedure I wanted to talk about is our secret radiofrequency microneedling. And this is basically microneedling on steroids. So, this is for patients that need a little bit deeper of a treatment. Skin Pen is great for preventing and kind of mild to moderate lines and wrinkles. Secret RF is going to give much better results and they'll last longer. So the difference here is that we have a little bit of energy that's placed into the skin with the needle. So it goes a little bit deeper, but you also have this heat that causes some coagulation as we create the damage kind of along the lines of Skin Pen. But that also means that our downtime is less. So we get these really great results that we see with more invasive procedures with minimal to no downtime. A lot of patients walk out and they look maybe a little bit pink. So this we can do all over the body as well. It's great for lines around the mouth where we have a lot of issues with women from sun damage. And it is just more powerful than the secret radiofrequency. So, getting a consult is really important to see which treatment is right for you. This also safe for all skin types. We can use it on darker skin types as well. And we do see better results with this than with Skin Pen microneedling. But again, we have very minimal downtime associated with it. Sometimes like after the last treatment, patients will have a little bit more redness. But typically you're looking at about 48 hours of mild to moderate redness, looking again like kind of a sunburn. And this one we do 3 treatments about 4 weeks apart. It takes 2 hours to do this treatment. Because it is deeper, we want to make sure that patients are numbed appropriately. So that numbing process takes about 45 minutes to an hour. And then the microneedling is about 45 minutes to an hour. This one we don't use any serum with. So this one is really, truly just asking your body to come back in and remodel and stimulate collagen where we're doing the treatments. We don't use any serums to inject because we don't need it. This machine is powerful enough by itself to, create that damage, control damage, again, like we were talking about, and your body comes in and repairs it. So we do really see great results with this one. Here's just a couple of before and afters. You can see that one on the left. I mean, look at her neck. It really even helps tighten up that area. It reduced the amount of jowling that she has. I just think that she got such great results with that. And it's not like you look like you've had anything done. You are going to look younger and people are going to notice, but it's not going to look like you've had filler or anything like that. And then on the right-hand side, and these are just after 1 and 2 treatments, which we recommend 3 for the best results. But, you can look around her eyes and see that she's got a lot of benefit in the crow's feet area, and then even around the lips. And so, I would think after 2 more treatments for her, after her full series, then she would be looking really a lot younger. We also do PRP and PRF here. And PRP is actually how I got into aesthetics in the first place, because as a naturopathic doctor, I really like the idea of, all natural, giving great results to patients without having to inject anything else. That being said, when we're injecting PRP and PRF, really, unless you're in your 20s, maybe early 30s, we're not going to see a lot of results in most areas. So, I was a little bit naive about thinking that injecting PRP would look like you've had fillers done. But where we do see really great results with these 2 treatments is with microneedling. So adding PRP into a microneedling session just stimulates a lot more collagen growth, and we see better results with that than with just microneedling and hyaluronic acid by itself. The other area that I do see a lot of benefit for injecting PRP and PRF would be under the eyes. So if you have a lot of eye hollowing or dark circles, we do see some great results with that, doing injections under the eye. And again, it's a safe procedure because we're using your own blood and platelets for that. And we just do a blood draw in the office. We spin it down and you can see the yellow in the tube there is the platelet-rich plasma. So that's PRP, platelet-rich plasma. PRF is platelet-rich fibrin, which actually acts a little bit more like a filler. So I use that under the eye along with some filler. It's like dermal fillers, so with Restylane. And that it's a little bit thicker, so it fills a little bit better. But again, for just injecting PRP and PRF, I don't really see great results. But microneedling and under the eye, fantastic results for those patients that are looking for a more natural way to reduce the signs of aging. Sculptra. So this is what we're going to be talking about at our event next Tuesday, which I'll just remind everybody of at the end. But Sculptra is an extremely powerful way to stimulate collagen in the whole face. So what we've been talking about so far is, collagen stimulation and remodeling on the surface to kind of reduce the look of fine lines and wrinkles. But Sculptra, when injected, actually builds new collagen and can revolumize the face, which is really important. So, we can use dermal fillers for that. Or if patients are okay with kind of taking a longer process, then Sculptra really lasts longer than filler does, and I think gives really great results. So we'll talk a little bit about that, but it is FDA approved. You do build your own collagen around Sculptra, and I would say it's my favorite way to stimulate collagen and facial rejuvenation top to bottom. So we can really use it like in the temples, cheeks, I do a lot of jaw work, and then nasolabials and marionette lines. And this is almost impossible to make patients look fake or overfilled. It doesn't happen that way. So I'll show you some before and afters in a little bit. A little bit more about Sculptra. So the way the treatment series works is typically patients will get one vial per decade of life. So for example, if you're in your 40s, we're looking at about 4 vials. And typically I will do that over 2 to 3 sessions. So say for a 40-year-old, I may do 2 vials, and then 4 weeks later, we'll do 2 more vials. And that might be the end of their treatment session. Whereas somebody in their 50s or 60s, we may have to add on a treatment session after that. But because it's collagen stimulation, we're not going to see those results right away. Collagen cycle takes about 4 weeks to start to appear, and then those results get better over time. So with this and with the secret radiofrequency microneedling, we start seeing results at about 4 weeks out, and we continue to see those results several months after that. And then there's a maintenance, obviously, with everything. There's going to be maintenance with it. So we're looking at 1 to 2 vials per year after that. And this is, in my opinion, the most natural way to revolumize the face without looking overfilled. And it can be used in conjunction with fillers. So patients who've had cheek filler, you get that immediate result, and then we can put some Sculptra kind of over it to, stimulate more collagen, makes the filler last longer, and gives better results. So here's a couple of patients that have had a series done, and you can see neither of these ladies look bad, but they're just kind of starting to look a little tired. The eyebrows are starting to fall in. You can see some deflation in the cheek area, and that leads to jowling. And so if you compare the photos on the left to the photos on the right, these women don't look like they've really had work done. They don't look filled, but you can see that some of the hollowing and volume loss is gone for both of them. And I think it looks very natural. So you can see that at 25 months, these patients, that's what they look like after their treatment series, which is longer than any filler on the market, besides some of the more permanent fillers that I don't offer. Sorry. Yeah. Oh, that's it. Okay. So in the studies that they've done, patients were still satisfied with their results 25 months out. And that's why I like recommending Sculptra to patients. And then just one more quick little plug for a peel that so if you talk to any of us about peels, we love the VI peel line. It's great for any skin type, and they offer a line of peels from everything to just basic anti-aging to acne to then collagen stimulation. And so their newest peel is called the Advanced Peel, and that one's specifically designed for collagen production. So, if you're not having any issues with pigmentation and you're just looking to reduce the signs of aging, then the Advanced Peel is a really good option for you. And I know that Elaine absolutely loves that peel. All right, so I just wanted to leave some time for questions. If anybody has any, just go ahead and write it in the chat box, and I'm happy to answer any of those. And then I'll talk a little bit about the special we're going to be offering. But while we're waiting for that, I did want to plug our event for next week again. So next Tuesday on the 23rd of February from 4:30 to 6:30, we are hosting Kaylee from Galderma, and she's the one who gives us all of our Restylane products, Dysport, but also Sculptra that I talked about. So we're going to be hosting a collagen kind of in-person educational event, which, if you've been to any of our events, we typically have a lot of fun. So you can come and have some champagne and cupcakes, and we'll be talking about Sculptra again. All right, Mickey asked, what areas can you do the secret RF? So you can do a secret RF anywhere on the body. So we've done like stretch marks on the abdomen. You can do anywhere where you have kind of, what am I trying to think? Like just a little, like you just need a little bit of skin tightening. So you can do it on the arms, on the face, neck, décolleté, and I would say abdomen are most common. But if you've got stretch marks anywhere, women will get it on the thighs and on the buttocks. You can do it there as well. And we see great results with body treatments for that. All right. Somebody else asked, what is Sculptra made from? And the compound is polylactic acid. And it was actually designed for patients that had wasting in the face from HIV and AIDS and from cancer. And so, that's how it originally got approved, but now we see a lot of facial indications for that. Another question was, do we do any type of fat transfer? We do not here yet. I would say the closest thing I have to a fat transfer treatment would be Sculptra. We see the same types of results with that. Great questions. Does anybody have any other questions? Have a little bit of coffee. All right. Well, if you do, go ahead and send them on over. Can I do needling or radio frequency with leukemia? So I would say if you're active in any type of cancer, then no. But we can always do a consultation and just make sure that, those treatments are safe for you. So if you have any questions, just, if you want to do a consult with Elaine for radio frequency microneedling or Dr. Walls for the secret, just give the office a call and those are free. We had a question about cost. So it depends on obviously the treatment. So Sculptra is $600 a vial. So we're looking at about $1,200 per treatment. And then, between 2 and 3 treatments, depending on your age. And then those, the maintenance treatments are going to be 1 to 2 vials per treatment. But we are doing some specials on Sculptra right now, which is going to save you significant amounts of money. Actually, let me go ahead and answer the questions first. We had another question about somebody who had done Secret RF. And should she do Secret or Sculptra first? It really depends on what we're looking for. But if you have done Secret and have not done Sculptra, then I would start working on Sculptra first, because that can also improve skin quality, tone, and texture. And then we do have specials for patients that have gone through our Secret RF microneedling, the series. You can get a good discount on your maintenance treatments every year. I would say go ahead and do the Sculptra now, a series of that. And then afterwards, you can do Secret RF again if you need it. All right, so our specials for the webinar, and these are going to be good through the end of March 2021. If you purchase any 3 vials of Sculptra, you get $300 off or 150 units of Dysport free. And Dysport is like Botox, so it's a neuromodulator. We use it, in between the brows, for the forehead, and for crow's feet. And that'll save you between $300 and $450. Just mention, that you were on the webinar. We're going to do 20% off of any skin pen microneedling packages with Dr. Walls. She's our newest staff doctor, and she is great at microneedling. So we wanted to, offer a special for her. And then $200 off the Secret RF microneedling package, which the package of 3 is $2,500. So if you're interested in any of those and you want to get scheduled, just make sure you mention to Mickey that you were on the webinar and that you need to get any of those specials. And again, those are good through the end of March. If you want to get signed up for our event, give us a call. We're looking forward to hosting some of our patients. We always have a good time at our events, and you can meet Dr. Walls and ask any questions. You can ask questions about Sculptra, about RF microneedling, about skin pen, any of that. So I'm going to leave it open for a few more minutes if anybody has any other questions. Our phone number is 928-277-7414 if you want to get scheduled for any of that. And thank you all for coming. I appreciate it.